my screen anyway. We've got a PowerPoint to go through. So yeah, the majority of the presentation is going to be PowerPoint presentation, and we're going to obviously, but we want people to ask questions as well. So there is a facility to ask questions through the conversation, which is the one which is yeah, people are already using it already, so that's fantastic. So yeah, you can open that panel down the side to ask questions, and Eloise will be writing down everyone's questions, and then we'll be able to kind of answer them at the end. And yes, I'm just reading the message there. Thank you for that. Okay, shall we get started? And yeah, I'm going to kind of I'll put my shared screen up anyway, and we'll get started in a minute.
I just wanted to let people know that there are live captions that you can add, so subtitles will come up at the bottom. We take no responsibility for any misinterpretations. But yeah, for some people it might be helpful if you struggle a bit to follow with a number of people talking as well.
Tenacious. Oh.
So Ian, did you say you're just bringing up your presentation?
Yeah, it's just going to come up now. It's just running a bit slowly. Here we go. That should come up now.
Yeah.
Okay. Is everyone seeing that now?
Yes.
Excellent. Okay. Well, we'll get started. I'm sure a few more people will be joining as we go along, but we don't want to keep people wait. Everyone who has turned up already, don't want to keep you all waiting too long. So we'll get started, and just want to welcome everyone in to the first webinar that the Enable Homerton are putting on. And firstly, a big thanks to Margaret Bingham-Crisp, who's there in the who for helping us kind of get all this off the ground and arranging this webinar today, and for arranging the emails that have been going out so far this week. And it's been a massive help, Margaret. Many thanks for that, as always. And what I just want to do is kind of explain kind of what we are going to be doing today in the webinar, and kind of introduce ourselves. So my name's Ian Causer. I work in Talk Changes, which is the talking therapy service in Homerton. We're based at St Leonard's Hospital, but at the minute we're working from home. So as I said, I'm kind of sat in my bedroom at home at the minute, talking to everyone. So welcome into my bedroom, and I'm going to be starting off the webinar and talking a little bit about introducing what Enable Homerton is, and talking a little bit around reasonable adjustments in the workplace. And then Shamsun is going to kind of expand on that further and talk about his own experiences of using Access to Work and how that can help and work in the workplace. And Eloise is there. She's going to be taking down any questions that anyone has. If you want to kind of type your questions into the conversation bar on the side, or there's also a raise your hand facility as well. Eloise will kind of be making notes of any questions, and then myself and Shamsun and Eloise will be happy to kind of answer them at the end of the presentation. And as you can see as well, we're also recording this webinar, and the recording of this will be available on the Enable Homerton page, which is now kind of been set up and is available. And so all you need to do is just search Enable in the search function on the intranet, and our homepage should come up. And there you can also see the staff stories. There will be a link to this recording, and also obviously contact information, and if anyone is interested in joining the staff network. So to introduce Enable Homerton, as hopefully you've seen the emails that have been sent out this week, Enable Homerton is the staff disability network for Homerton University, and with the aim of kind of building disability confidence from the inside out. One of our main aims being to create an inclusive workplace where disabled employees feel empowered to ask for the adjustments they need, and managers feel equipped to support a diverse workforce. And we are working to make Homerton a place where disabled staff can be their authentic selves. So that's quite a tall aim, but it's, and as a staff network, we've been in the kind of gestation period for all of this year, basically for the whole of 2020, and we've been kind of building up. We've kind of chose this week because it is, as you've seen, also is the United Nations International Day for People with Disabilities today, and so we thought that this would be a good kind of focus to kind of introduce Enable Homerton to everyone working within the Homerton Trust. And there's also information within the emails that have gone out today about Purple Light Up as well, which is, if you follow the links in the emails, you can find more information about how they're acknowledging this particular day as well, and kind of creating a kind of a unifying voice kind of around the world through their really interesting initiative. And the Purple Light Up is the reason why we've chosen the colour purple to kind of to represent Enable Homerton as well. So, as I say, at the minute we're a small network of staff dotted across the trust. One of our main driving forces, Ishraga Lloyd, unfortunately can't be with us today, but I just wanted to kind of mention Ishraga, who's been kind of really kind of forced this through over the last year, has led this network and got everyone else kind of motivated and involved in it. And obviously, and now what we want to do is to kind of, as I say, introduce it to everyone across the trust and encourage as many people as possible to get involved, and to bring your own ideas, bring your own experiences, bring your own knowledge, and to widen our aims and to widen our objectives. And so we're happy to have as many people involved as possible, and for people to contribute as much as possible, because it's a staff network, and the more staff that are involved, the stronger it will become, and so that's kind of one of the main aims for today as well. Is just to kind of welcome everyone in and hopefully have more people interested in being involved in the network. And so in the presentation today, I just want to kind of, as I said, I'm going to be focusing on reasonable adjustments, but before we get to that, I just want to address the term disability. What is disability? If we're calling ourselves the Staff Disability Network, then lots of people have very fixed ideas about what is or isn't a disability, and a lot of people who may have a disability wouldn't ever consider themselves as being disabled. And so I just wanted to kind of introduce the idea of what is disability in terms of Enable Homerton and the Staff Disability Network, in that we're going by the definition that is used by the Equality and Human Rights Commission. and as defined under the Equality Act 2010. And so that's the definition of a disabled person in the Equality Act 2010 is a person has a disability for the purposes of this act if they have a physical or mental impairment which has a substantial and long-term adverse effect on their day-to-day activities. And so if you would kind of consider yourselves for a second and think, well, do I fit under that definition? Then there's kind of three questions to ask essentially is, do I have a physical or mental health impairment? And I'm going to come on to that, what that exactly means in just a second on the next slide. Is it long term? And the Equality Act defines long term as being 12 months. So have I experienced this physical or mental health impairment for at least 12 months, or am I likely to experience it for 12 months? And then thirdly, does it have a substantial effect on my day-to-day living if I discount any aids, treatment or medication I've been taking for it? So vast majority of people who would fit under that definition would suggest, well, I'm able to, live my life just the same as anyone else on a day-to-day basis because I either receive this treatment or I take this medication or I use aids or adaptations. But if you were to take that away, then if your health condition or disability has a substantial or would have a substantial impact on your day-to-day living, and it's lasted for more than 12 months or is likely to last for more than 12 months, then it is likely to be defined as a disability under the Equality Act. And essentially that's the definition that we're using in Enable Hoemrton, and that's the definition that the Homerton Hospital itself uses when talking about disability in the workplace. And so I just want to kind of show you one more slide on that as to what the Equality Act defines as a physical or mental health impairment. And so what it does, it kind of breaks down a whole range of health conditions into different kind of categories or groups, essentially. And those are the ones I've kind of put in bold on these bullet points. So we have what's termed sensory impairments. So that can be impairments which affect sight, hearing, etc. We have impairments with fluctuating or recurring effects. And so that can be conditions like arthritis, ME, fibromyalgia, epilepsy. And then they have a category called progressive conditions. And that can be things like motor neuron disease, multiple sclerosis, HIV, cancer, forms of dementia and lupus. There can be organ-specific conditions such as asthma, cardiovascular diseases, including thrombosis, stroke and heart disease. It could be developmental conditions such as someone being on the autistic spectrum or someone with dyslexia or dyspraxia. And then there can be learning difficulties, and also mental health conditions are covered, such as depression, schizophrenia, eating disorders, bipolar, OCD, or any other kind of physical or mental injuries to the body or brain. So as you can see that the definition of disability is very, very wide ranging. And essentially what it is saying is if you fit into one of those categories, and just going back the slide, and it has lasted for more than 12 months, and that if without any treatment, medication or aids or adaptations, it would have a substantial impact on your day-to-day living, then any one of those health conditions is likely to be deemed a disability in terms of the Equality Act and in how Homerton Hospital itself would recognise it. And so with that in mind, the NHS more widely has introduced what's called the Workforce Disability Equality Standard, or WDES, very catchy title of WDES for short. So the Workforce Disability Equality Standard is mandated by the NHS Standard Contract and is applied to all NHS trusts and foundation trusts since April 2019. And the WDES comprises 10 metrics, and all of the metrics draw from existing data sources such as recruitment, ESR, the NHS staff surveys, HR data, etc. And they collect this data on an annual basis, and the collection of these metrics allow NHS trusts and foundation trusts to better understand and improve the employment experiences of disabled staff in the NHS. And so last year, obviously Homerton gathered together all of their data that they have and replied to these 10 metrics. And I just wanted to I've pulled out 3 from the report that the Homerton produced last year that are kind of related and relevant to kind of what we're talking about today. So I just want to kind of introduce those 3 to you, as you may not be aware of this data and you may not have seen the report. So metric 1, the first metric, just basically asks how many people within the trust identify as having a disability or a long-standing illness or health problem. And the information that Homerton provided was it identified from the 2018 staff survey, 287 respondents, otherwise 16% of those who responded, identified in the staff survey that they have a long-standing illness, health problem or disability. However, when compared with the information that the Homerton has on staff, when staff were recruited, and it asks that question before someone starts in a role, do you consider yourself to have a disability? Only 4% of staff indicated at that time that they have a disability and or long-term health condition. So that's quite an interesting disparity between people disclosing openly to the trust before they start their job that they consider themselves to have a disability, and those who would reply anonymously in a staff survey. And it highlights a very common issue for people with disabilities and health conditions around disclosing their health condition to their employer. And this isn't just relevant to the Homerton Trust, it's relevant to all employment and right across the board. And so I think that's a very interesting metric and a very interesting outcome. And it is something to work towards around how can Homerton as an employer, but how can individuals, managers and staff kind of promote and support the idea that disclosing a health condition or a disability would actually have positive consequences, as opposed to being people might consider it what could have negative consequences, or there's stigma attached to it, or it could end up in that person being discriminated against. And then the other 2 metrics I wanted to kind of highlight was where it says the question was asked, percentage of staff saying they felt pressure to come to work despite not feeling well enough to perform their duties. And so in the staff survey, the people who identified themselves as having a long-term health condition or disability, 29% of those said they felt pressure to come to work despite not feeling well enough to perform their duties, whereas 23.8% of those who didn't identify as having a disability said they felt pressure to come to work despite not feeling well enough to perform their duties. And this is from the 2018 survey. And so again, I think it's an interesting difference there in relation again to how someone with a disability or a long-term health condition feels either their situation is understood or how they feel they might be supported at work. And then the final metric I wanted to highlight is one that we're going to be looking at now, is percentage of disabled staff who say that their employer has made adequate adjustments to enable them to carry out their work. And the latest survey had 74% said yes, that they consider their employer has made adequate adjustments, which is great. That's absolutely fantastic news. But I think it can be higher, and we would like it to be higher. And so that's why we kind of wanted to kind of talk a little bit about reasonable adjustments today, and just highlight this particular area and around what support there is both for staff and for managers in making reasonable adjustments at work. And so going back to what the Equality Act says, is that the Equality Act states every employer is under a positive and proactive duty to make reasonable adjustments to remove or reduce or prevent the obstacles a disabled worker or job applicant faces by doing one or any of the following three areas: providing extra equipment, support or aids, removing physical barriers, or changing normal practices or provisions. And an interesting part of what the Equality Act states is that employers are allowed to treat disabled people better or more favourably than non-disabled people, and sometimes this may be part of the solution. And that can be quite a common response. Again, I'm talking far more generally here, across the board. When I've worked with employers for many years in my role as an employment advisor, and a common reason I get back from employers when they say they can't make reasonable adjustments is that, well, if I make an adjustment for this person, everyone else is going to want it too. But the Equality Act is very clear that it says you can treat someone with a disability more favourably than someone without, if that's going to be part of a solution to removing, reducing or preventing the obstacle that person is facing. And so examples of reasonable adjustments that are listed within the Equality Act is quite long, and here's some of them here. So it can be making adjustments to premises or equipment, altering hours of work, modifying existing policies and procedures, allowing time off during working hours for rehabilitation, assessment or treatment, providing additional training or supervision, modifying instructions, assessments and equipment, providing equipment, allowing a period of disability leave, redeployment to fill an existing vacancy, assigning a different place of work. And so obviously not all of those adjustments are going to be relevant to all people. It's about finding what is relevant, what would work, what would remove, reduce or prevent the obstacle that individual is facing. But that gives a kind of, again, a broad idea of all the types of things that could be reasonable in individual circumstances. And so one of the key understandings about reasonable adjustments is what is reasonable. And again, the Equality Act says that the test of what is reasonable is an objective test, and it is not a matter of what the employee or the employer may personally think is reasonable. And so the Equality Act states that when deciding whether an adjustment is reasonable, an employer can consider, again, any of the following: how effective the change will be in avoiding the disadvantage the disabled person would otherwise experience, its practicality, the cost, the organisation's resources and size, and the availability of financial. But it goes on to highlight that the employer's overall aim should be, as far as possible, to remove or reduce any substantial disadvantage faced by the disabled worker which would not be faced by a non-disabled worker. And so just to pick out one of those there, where it says the organisation's resources and size. Essentially what that's saying is an organisation as large as the Homerton Trust would be expected to do more than a small employer who employs just 5 people in a single office. And so when considering whether something is reasonable, that is taken into consideration around how much flexibility there can be in providing the adjustments for the person to remove the disadvantage or obstacles they may be facing. And so what Homerton has done in relation to this, in relation to all of this guidance from the Equality Act, is they've drawn up a reasonable adjustment policy. And if you're not aware of this, and if you've not come across this before, then please do seek it out. It's on the intranet. Just type in reasonable adjustments and the reasonable adjustment policy and procedure will come up. And it's a very good policy. It has very clear guidance and guidelines in it for both staff and managers on how to implement this policy. And what I wanted to do is just highlight a couple of key areas of this policy and what's in it. And so what the policy says is, within its aims and objectives, is the reasonable adjustment policy aims to raise awareness amongst all staff of the moral, social and legal obligations to make reasonable adjustments for people who are disabled or who have a long-term health condition, and in particular the requirements of the Act i.e. the Equality Act. Another aim is to encourage disabled staff to request reasonable adjustments and to feel confident in the knowledge that they will be supported by the Trust should they require them, and to provide staff with a procedure to be followed if they feel that this policy is not being adhered to. And so essentially, as I say, it's there to support staff and also to support managers in going through the process in how to request reasonable adjustments and how to make reasonable adjustments in the workplace. And what it also includes, which again is really great, and again, when speaking with other employers around these issues, I always talk about the idea of having, of any reasonable adjustments are made, to put it in writing, to have an agreement between the manager and the individual member of staff. And the Trust has this within their policy, and it's called a reasonable adjustment agreement. And there is a template within the policy that anyone can download and access. And it says a reasonable adjustment agreement is a living record of reasonable adjustments agreed between a disabled employee and their line manager. And the purpose of this agreement is to ensure that both parties have an accurate record of what has been agreed. It minimises the need to renegotiate reasonable adjustments every time the employee is reassigned a new manager within the organisation. And it provides employees and their line managers with the basis for discussions about reasonable adjustments at future meetings. And that middle bullet point is a very common issue that does arise for a number of people, is either when a new manager comes in, or they might be redeployed to a different department, that they then have to start again from the beginning about agreeing and requesting reasonable adjustments. And so by having this reasonable adjustment agreement in place, it's almost like a contract, where you say that this has been agreed, and so wherever I work within this organisation, these adjustments go with me, essentially. And it's a really important kind of part of the reasonable adjustment policy, and it's something that we within this staff network would love to see used far more widely across the whole Trust, and for managers to be aware that this exists, and for staff to be aware that this exists, and for it to be used on right across the board, because I think a lot of people aren't even aware that this exists, and people who've had reasonable adjustments put in place didn't know that this is there, and so I think one of the things we want to do as a staff network is to kind of promote this reasonable adjustment agreement and to see it used far more widely across the whole Trust. And what we would also like is to support line managers to use this policy and to use this agreement, and we know already from some of the feedback we've been getting is that some managers don't feel confident in this area, don't feel confident having these conversations, are not quite sure what is an adjustment, what isn't an adjustment, not quite sure what they should agree to, what's reasonable, what's unreasonable. And that managers want to do the best by their staff, but don't always feel fully equipped or fully confident in being able to do that. And so, I mean, what would also be great is if there could be some form of, using this webinar as a starting point, some form of training available as well for staff and managers across the board around implementing reasonable adjustments at work. There's already training in place for around implementing the sickness policy and sickness monitoring, and this reasonable adjustment policy is kind of an add-on, is linked from the sickness policy, and I think it would be great if this had its own kind of avenue for managers and staff to receive training on using this as well, and the benefits, I'm sure, would be very positive right across the board. But that's coming to the end of my presentation. Oh, and just sorry, that final one, and that is a copy of what it actually looks like in the policy, the reasonable adjustment agreement, and it's a very simple form to fill out. The employee fills out, my disability has the following impact on me at work, and then then it just lists the following reasonable adjustments have been agreed. I mean, it's as simple as that, but it can be very, very effective and can create a lot of confidence and reassurance to both the employee and the manager. I'm going to hand over to Shamsun in just a second, and he's going to talk more about access to work. And so, as we saw there, one of the key things around what is or isn't reasonable is the cost. And some adjustments can cost a bit of money, certainly when you're looking for equipment or adaptations to equipment. And so if there isn't money within the service for that, then the service can use access to work. It's government funded, and it says it they'll be offered support based on their needs, which may include a grant to help cover the costs of practical support in the workplace. And so I'm going to hand over to Shamsun in a second, who's going to give you his personal experience of using access to work and how it's benefited him. But just to say, if anyone wants any further information on the Equality Act in particular, then do seek out the Equality and Human Rights Commission website at equalityhumanrights.com. There is also a helpline at the Equality Advisory and Support Service, and also ACAS is always a fountain of knowledge and information, and their website and their helpline can be accessed by anyone seeking further information about employment issues. But I'm going to close this now. There is our email address, and there is, as I said, you can also find us on the intranet. But I'm going to stop sharing my screen, and I'm going to hand over to Shamsun, who's going to, if I can find my, there we are, find my cursor, and who's going to tell us more about access to work.
Thank you, Ian. Hopefully everyone can hear me okay. I've got some building work going on around me, so I apologise if you talking. So just to introduce myself again quickly. So my name is Shamsun Ali. I've been working with the Trust since 2014. I'm based in Hackney Arts, one of the community sites in Boston.
Shamsun, you've got a bit of an echo.
Have I?
Have you got a couple of devices next to each other or something?
Yeah, give me a second. Sorry.
That's better.
It's better, is it?
Okay.
Yep.
Okay.
It might be helpful if everyone goes on mute as well, then, to reduce that.
Okay. Yeah, is there an echo at the moment?
No, you're good.
Great. Yeah, so I've been with the Trust since 2014. I'm based at Hackney Arc, which is in Dalston, and I work with young people with learning difficulties, autism, mental health conditions, to help them, to support them to be more independent in the community. And I've been doing that for the last couple of years, although I've done another role prior to that within the same team. So I guess you could say I'm kind of well placed in a way to work with young people with disabilities. I guess it does help. It does help to break down barriers. So I'll just start off. So I'm going to talk about access to work, obviously, but just before I get to that, maybe sort of hanging on to what Ian was discussing earlier in terms of reasonable adjustments. I just wanted to talk about recruitment just for a short moment. So what I wanted to mention was that Homerton are a 2 ticks employer. They certainly were when I first applied in 2014. And the 2 ticks scheme is awarded to employers who've shown good practice in the recruitment of employees with disabilities. And what it is, it's a guaranteed interview scheme, actually. So any employer who displays the 2 ticks symbol and is advertising for a role to be filled, that applicant, if they meet the minimum required criteria, they are actually guaranteed an interview. So that could be one of the advantages of disclosing that you have a disability. You might be guaranteed an interview. And when it came, in terms of Homerton, when I attended my interview, there was someone from HR there as well. So I think they do that when an applicant indicates that they have a disability. HR, I think, also sitting on the interviewing panel. So that's quite important to know. I think they do that to make sure that things are fair across the board with all candidates being interviewed. So that's really helpful as well. And I always like to promote sort of discussing maybe at the end of an interview your disability, maybe how it affects you, because why I say that, the interviewing people, they might not feel confident, or they might feel that they're intruding on you, asking you questions. So if you bring it up, it sort of gets rid of all those issues, and it just creates a better environment to be open and talk about your disability and how it affects you in the workplace. So the manager can then maybe think in advance about what it is that they can do to make things a bit better for you in the workplace. Okay, so that's quite important, I think, in terms of recruitment. So I'll move on to talking about access to work now. So access to work, actually, I think is not a very well-known service from the Department for Work and Pensions. I mean, I've talked to people who work for the DWP, and even some of them have never heard of it, and they work at the job centre. So I don't know why it's not advertised a lot. It's hard to say, but it's been around since way before 2009, which is when I first came across it in my career. So as Ian said, Access to Work is a government-run scheme, and it's there to support employees in the workplace, so that they have like an equal footing with their able-bodied peers. So during my career, I've applied for Access to Work 3 times. So first in 2009, and then in 2014, and then again in 2018. So there's no limit as to how much you apply, and you can even apply, if your condition changes, or there's some changes, or you have an additional condition, you can always get in touch with them to talk about it and discuss it with them. Okay, so how do we initiate the contact with Access to Work? So there's a couple of ways that you can do this. You can go on to Google, search for Access to Work. There's a link to the www.gov.uk website. We'll share it with you after I finish speaking. So you can go to the website, you can apply that way, or you can actually call them on a phone number and speak to someone as well, and they can talk you through it. There is also, if you are not able to use either of the previous methods, you can also write in to them as well. So there's a number of ways that you can contact them. So when you initially make contact with them, they will ask you for your personal details, your place of work, the details of your line manager, and obviously the details about your disability. Okay, so what happens after that? So after that, you should be getting some form of contact from the DWP. It's usually a phone call, and an advisor will be speaking to you a bit more to understand your condition. I think they do this to make sure that they are sending you the most appropriate assessor for your disability. And the assessors, they don't work for the DWP, they are actually independent. So mostly they are sort of charitable organisations such as the Royal British Legion, who are commissioned by the DWP to do workplace assessments and do the onward sort of like advice, guidance and suggestions for equipment. So there's a number of specialist assessors who can do this on behalf of the DWP, but they are independent. Okay, so once you have arranged a time to meet with the assessor, it's always good to have your line manager available to meet with the assessor as well, because they can talk about your day-to-day job activities and what you're expected to do. And also it's ideal to have it in your normal place of work. So I'm based at Hackney Ark, and I had both of my assessments there. So we went through sort of, I think at that when I first started with the trust, I was doing an admin role. So we went through, you know, all the admin related tasks that I would be doing for my team, the different areas of the building that I might be based in. And that just gives the assessor an understanding of, you know, what the employer's work situation looks like. They would then go through with you your disability and how it affects you, and how it sort of affects you in your day-to-day work life. Okay. And so in my case, when I did this in 2014, because I'd already had a access to work assessment in 2009, and luckily I was working for a couple of visual impairment charities. So I kind of had a good idea of what equipment that I needed. So I was able to say to the assessor, I need A, B, and C. I've used these things before and they're quite useful. So I was able to do that quite confidently. If I didn't know, then I'm sure he would have advised me on what solutions are out there, which is what happened when I first applied for access to work in 2009 in my previous job. Okay, so after the assessor has visited you in your workplace, they will then go away and produce a report which will be shared with yourself, your line manager, and most importantly with access to work. So in the report, they will have details of your discussion with them, and also they will list any equipment that they are recommending, and the costs of that equipment as well. So when it comes to equipment, they always go to 3 different suppliers, so they can justify the costs. And you know, if it's an equipment, you know, some people get put off like as a disabled person. Like when I first saw my access to work report, I was thinking, oh, this is not going to happen. It's quite expensive. But you know, if you need the equipment, access to work won't say no. Like there's no cap on the equipment that can be purchased. Okay, there is an expectation of some form of costs contribution from the employer. So if it's a large employer like Homerton University Hospital is, they would be responsible for 20% of the costs of the equipment. Okay, but there is no cost. So if, for example, you needed a support worker in your job, your employer is not responsible for any of their costs. Access to work would cover all of those costs, as well as any costs for transport. So as an example, I have a support worker who works with me. They can work with me for up to 24 hours a week. So if I need them, you know, for the full 24 hours of that week, I can utilize them. If I need them for a shorter time, then I can do that as well. And they then go away and do a claim form and get the money back from access to work. I also have been given a grant to use taxis to get from home to work and back again, but also whilst, because the nature of my job, it means I go out and see clients within their homes and in the community. So I've got a grant as well to be able to do that. So I can get, they call it travel in work support. So I can do that. I can get cabs whilst I'm in my hours of work to get to wherever I need to. So that's really sort of, it's really useful, and it does takes the stress out of a lot of things, because you know, people with disabilities, when we are, or certainly when I am, you know, trying to plan my day, I have to also think about how my vision might affect me. So even when I was, you know, when we were planning this webinar, I had to think about what technology am I going to use to get on, and will it be compatible with, you know, with the other pieces of equipment that I'm using. Okay, so once the DWP have received your the assessor's report, they'll then get back in touch with you and your line manager and go through the recommendations with you and your line manager. You'll then probably get a letter to say that the grant has been approved and that the equipment should be purchased or the support should be arranged. Okay, so once you do get the grant, it is quite important to sort of try and get things purchased quite quickly, especially if you're buying it through the trust's procurement system. Things can take a bit of time. So for in my case, my last Access to Work assessment was approved, but it took about maybe 3 months, around 3 months, to get all my equipment sent to me, and that was just because of the way we procure stuff in the NHS. So that's quite important. Get that done. And then after you have received all of your equipment and you've set up any support workers or any cab companies or things like that, it's important then to reclaim those costs. So Access to Work, when they've approved your grant, they will be sending you forms to explain how you can reclaim the money. So do that as soon as you can, because I think you get about 6 months from the point of your grant being approved to purchase the equipment and to reclaim the money. Okay, so it's quite important. Otherwise, you'll be in the unfortunate situation of having to apply for the grant again, and it's just not ideal, because then you won't be ready to start working with all your support in place. Okay, and it is quite important to say as well, with Access to Work, you don't have to wait until you start the job to be able to apply for it. You can apply for it, I think it's up to 4 weeks in advance of your starting date. So that's quite a good thing. So it gives you a bit more time to get things sorted out before you start. But it usually takes, an application would probably take about 6 weeks to complete. It can take longer. For me, it did. The second time I applied, it did take a bit longer. But it happens. I think it just depends on how busy they are and who your advisor might be as well. I also wanted to say, when Access to Work receive your application, the assessor's report, sometimes they will, well, with me anyway, they did try to get me to do their work for them. So they, which can be a bit off-putting, they tried to get me to negotiate the costs for some of the equipment, and I said, well, I shouldn't be doing this, and then luckily they took on that role and they did it. But if you do go for Access to Work, you'll have the sort of the conviction to say, no, you do it. So that's quite important to sort of remember as well. So I'm just trying to see what I've covered. Okay, cool. So so once you've got your grant in place, and you claim the money back, that's fine. So if you also are getting a grant for support with taxi fares, or for a BSL interpreter, or for a support worker, you will need to make sure that you as an employee are claiming for those costs each month. So what I do at the end of the month is I get an invoice from my cab company. I then fill in an Access to Work claim form and I send it back to them, and they then usually pay the money into the cab company's accounts within about 2 weeks of receiving the claim form. With my support worker, he'll invoice me, and I'll sign his timesheets off, and then he does his own Access to Work claim form, and then he gets paid. So it's quite important to maintain that, because I think you only have like 3 months to claim any money back from Access to Work. So I'll just quickly put up a little slide where it will show you some of the contact details for Access to Work. So you can either note them down, or if you are going to be viewing the webinar a bit later on, you can capture it then. So just bear with me a moment, guys. Does that come up? Yeah, I think that's come up now. Yeah, so it's just giving you like a little reminder as well about the steps that happen for me anyway. So yeah, so initially you would, contact Access to Work by phone, email, or you can write into them as well. You then get a phone call from Access to Work. An advisor will be appointed to you. They will then arrange for a workplace assessment by a suitable person. Usually it's someone who's got an occupational therapy background. After your assessment's been done in your workplace, a report will be created for Access to Work and yourself. It will then be sent off to be authorised by Access to Work. Once it's authorised, you will then be given a letter saying that a grant's been awarded and that you should start purchasing the equipment. So you start buying your equipment, and then once you've got it, claim the money back for it, and hopefully you are good to go. That's my experience. I think it's going to be different for everyone. Even for someone else with a visual impairment, it will probably be different for them as well. So it's quite important to remember that. Yeah. So thank you for listening, guys. I hope that helped you in some way and that you've learned a bit. So I'll just end the presentation there. Thank you.
Excellent. Thanks, Shamsun.
Thank you, Ian and Shamsun. We have 5 minutes left for some questions. I've got one from Alex Hitchcock here about, I think you might have answered this already, Shamsun, but I'm just going to ask again. How do HUH and the individual pay for in-work taxis? So is it reimbursed afterwards, or do you get given a sort of set amount of money?
Okay, so I have an account with a local cab company. So they just send me an invoice, and I then have to claim the money. So it's nothing to do with Homerton at all. But with my travel in work, I've spoken to my land manager about this recently, actually. So I am able to claim, because with travel in work, the Access to Work, they expect the employer to pay like I think it's about 45 pence per mile or something like that. So I am able to claim that part of the cost back through work, and the rest of it's covered by Access to Work.
That's great, thank you. Does anyone else have any questions? You can use the little raise hand thing, or just let me know in the chat. So Thelma has a question. Are you bound to the organisation to stay with them for a given period of time as a return on their investment? Is that in relation to Access to Work? I'm imagining.
Sorry, I was thinking.
Sorry, Thelma, go ahead.
Oops.
Oh, okay. So are you bound to the organisation to stay with them for a given period of time as a return on their investment? No, the simple answer is no.
Okay.
So so you don't have to stay. You carry on as you are. So any equipment that's been purchased for you though will belong with the trust. If the trust are happy to give it to you to take to your next job, they can do that. So from when I moved from one job to a new one, my employer did let me take the stuff with me, and all that meant was that Access to Work saved a bit of money. But no, you don't have to stay with your employer just because they have contributed towards the costs for the equipment.
Great, thank you.
Thank you.
Okay.
Does anyone else have any questions?
Yeah, just simple question. The all that's been discussed in that last hour apply to all staff, or are there reservations for staff bank workers?
Do you mean the access to work grant?
Both parts, the part from Ian and the part from you.
Okay. From the access to work perspective, if you are in employment and you have a contract, then you're entitled to the support. It's only for things, I think, like so if you're going into like some like apprenticeships, for example, access to work is not always available, but it's different in each case. But certainly, I think if you have a contract that says you're a bank worker, then the access to work grant would still be in place.
Okay, and the reasonable adjustments as well?
Yeah, so reasonable adjustments, yeah, cover all employees, all paid employees, yeah, whether they're bank, temp, or permanent. I think the only people it doesn't cover is volunteers. I think volunteers aren't covered by that, but any other type of employee is, even if you're on any type of contract.
Any other questions? I think I might have had one. I can't find it. Oh, we might have one more. So I think, Margaret, I wanted to ask you a question about the 2 ticks employer. And was that right that if you declare your disability in the application, then HR would sit in? Because that
I don't know necessarily. The 2 ticks is what Shamson said was it would be a guaranteed interview.
Right, okay.
HR would not. I don't know. It depends. Sometimes HR are involved if there is an internal candidate.
Mm-hmm.
For fairness, I'm not aware that we would necessarily sit in an interview on any other case just because somebody has got a disability. No, it would be fairness, because when Shamson was interviewed, there was probably an internal candidate within that pool of interviewees, and it's just to ensure fairness.
Oh, right, okay.
Okay, yeah. I have seen on one of the I can't remember which policy it was, but I have seen one of the policies made that candidates can make a request for someone from HR to be there.
You can request that I think it's like what you said, if you need, we can provide equipment, you can bring somebody, support, if you need a translator or you need somebody with you, then that would all, but so HR might be involved because the manager would go back to them and say, can we set this up, how can we organize it, etc.
And could you, as someone being interviewed, could you request to have someone join, to have someone from HR join?
I'm not sure. I would have to go back and ask that question. Recruitment would probably be the best place than me to answer that question.
Okay. And I just wanted to say one thing about people. I don't know how many people here would have disabilities, but in terms of when you make an application, I know certainly that because I had declared it in my application and I discussed it with my line manager as soon as I started, when I did start to have problems at work, they said that it was much easier to help. And if I hadn't declared it, it would have been more difficult. And I think there would actually be grounds to dismiss you potentially, or it's easier to do.
I wouldn't know. I'm not I sit with an HR, but I'm not an HR professional. But
it's just something I wanted to point out for people.
Yeah,
just if you're applying in the future, it's actually the stigma of mentioning it. It's actually more beneficial than you would imagine.
Yes.
I think.
Yeah, and I think that's when Ian showed the earlier slide. I mean, our figures, it's actually 4%. It has improved since we've been monitoring the data, and it's gone from like 2.9%. But when you consider we've got over 4,000 staff, that's substantive staff. That's not including bank, just to clarify for people. where we 4%. I mean, that could be historical, because I mean, when I joined the trust many years ago, I applied on a piece of paper, and whether it was transferred to ESR, but then people's circumstances changed. You know, you could join us with a disability or long-term health condition, or it could develop during your work. But you know, as an advocate for this work, I would say to people, it is, you know, it is helpful if we have this information, because we can you with the things that the reasonable adjustments, what Shamsun's been talking about today. It, you know, it will not be detrimental to your employment. It would be beneficial to your employment, because we would have that information and we'd be able to support you through whatever course that you needed it.
Thank
and
you.
if I may add one more point to what Margaret just said, that's from experience from way before working at Homerton, so there's no issue there. I first declared to HR, and then I was advised by HR when things started to go south that I should declare it to my line manager. And then what happened is that 2 weeks later, my line manager invited me for an interview to inform me I was going to be made redundant, but that's a different story altogether.
Can I just add that you can go on to ESR yourself and update your records. So it's not something you can get HR to do. So you can go on. The only thing you can't update, as far as I can tell, like you can change your address and stuff. You can't update your qualifications, reasons, but you can update your personal details. So, you know, one of the things through employee self records, you can do that yourself. And one of the things that we are doing, which will be coming out through the appraisal process as well, is introducing sort of that conversation around well-being. It may not just relate to these conversations today, but just that checking in with a manager and an employee. How are you today and how can I help you? Because I don't know about everybody on this call today, but we've all struggled over the last few months at different times. So it's nice that we are starting to look at the well-being of all of our staff, and that's sort of the conversations and how we can look after each other going forward.
Thank you, Margaret. I've got a couple more questions. Someone has asked about home working and if the home environment can be assessed. Do you know anything about that, Shamsun, for access to work, and I guess reasonable adjustments as well?
Yeah. Okay. So for access to work, I'll be honest, I don't know, but certainly when the first lockdown happened here, my manager, I had a laptop anyway, but my manager ensured that I was given a monitor as well, and that helps me quite a lot. It made a big difference, because when I didn't have it, I was struggling a little, still getting on, but just having the monitor just makes it a little bit easier. But I'm not sure about access to work and home working.
I think so, because if you say, as a given example, lockdown, if your employer is saying you have to work from home, then the employer would also have to check that you have the reasonable adjustments in place that you require. And again, if that costs money, I'd imagine that they can apply for access to work. I haven't had a specific case where that's happened, so I don't know for sure, but I'd imagine that would be the case.
Okay, thank you. I've got one last question. Someone asked about an invisible disability, and if they are bound to declare it, if they need to declare it. I mean, I think you don't have to declare a disability, do you? But
No.
certainly, I think in my own personal circumstances and in Shamsun's, it's beneficial to declare it.
Yeah. For me, it's definitely been beneficial. I think it would have been obvious if I hadn't declared that I had some sort of issue. So it's definitely helped. And also, like, you know, I think it helps certainly in the place where I work. I think and the people that I work with, I think it can be maybe like motivational, inspirational to people as well. But you don't, you know, if you feel like you don't want to declare, that's that's completely up to you.
But I'd say, I think, just to jump in, the question referenced diabetes. And so again, if the individual is taking insulin or medication for that, then it is likely to be seen as a disability under the Equality Act. Yeah. But if you're managing that fine and you don't need any adjustments at work, there's no obligation to declare that. Yeah. But obviously, if you don't declare it, your employer has no obligation to make adjustments. You know, your employer, the obligation on the employer only starts when they have a reasonable awareness that you may have a disability. So if you don't declare it, then the employer has no obligation either. But if you're managing it fine, you don't require an adjustment. You don't need to declare it.
And if I can just add to that as well, you know, if your manager doesn't know that, for example, if they don't know that you've got diabetes and you then have some sort of a medical emergency, it will be very difficult to, you know, for them to figure out, you know, what they can do to help you immediately. So there's that. So there's those sorts of considerations as well to take into account when you're making your decision.
I think it can also be helpful just to have colleagues, like your line manager, definitely, but also if colleagues understand a bit more, they can be more flexible and understand what's happening with you. And it is very difficult to share that. I mean, I personally find sharing my story very difficult, but I think it just helps people to be able to work with you as well, because that's important. And also from a professional registration point of view, I think I personally feel a responsibility to be safe around my patients. And so I have to be able to talk about my condition and how to keep myself safe so I can keep my patients safe. So that's certainly a consideration, I think, if you have a professional registration that you need to maintain. Any last questions? No. So I just wanted to thank everybody for coming along. Ian mentioned about Purple Space and the Purple Light Up, and there's links in the emails and on the intranet. So if you search Enable, I think there's links within there for you to be able to look that up. And yeah, we hope it was useful, and thank you to Ian and Shamsun for the presentations. I certainly found it very helpful. And yeah, we just wanted to ask you to keep an eye out for the last email coming out tomorrow with the final story and some more information about the Enable network. So and please get in touch with us if you would like to. Yeah, thank you very much.
And can I just, and if anyone does have another question that they didn't want to ask in front of everyone else, then obviously, yeah, do email us as well. And the email address is on all the emails. And if you're interested in joining the network, attending upcoming meetings, then please do get in touch. The more the merrier. And hope to see you all again very soon.
Yeah, thank you.
Thank you, everyone.
Thank you all. Thank you.
Thank you, Margaret, for answering questions.
Bye.
Bye.
Thank you.
Just end the recording there.